Welcome to the Suicide Prevention Show here on 1360 WLBK, a show that tries to shed a little light on the darkness of suicide. We have the whole gang with us here, Mr. Chuck Seabrass. Chuck, how you doing, my friend?
I'm doing wonderful, and as always, happy to be here.
Tamara Sutton, author of Demetrius, My Gift of Life. You can visit Tamara at tamarasutton.com. Tamara, how you doing, my dear?
I am wonderful and happy to be with y'all again. Thank you.
And, of course, the heartbeat of the program, although he denies it, Citizen Mike. Citizen Mike, always a pleasure when you're here, and especially a pleasure when you bring a special guest. And who did you bring with us today?
I'll tell you in a moment, but actually I'm the... what are those things called? The pacemaker. I'm the pacemaker, man, because I couldn't be the heart. This is a fabulous journey that we're on. Absolutely. And on this journey, we get to meet some, really way cool people. And that's somebody we have in studio today. And her name is, some people call her Dr. Di, or Di
Dr. Di Semmelhack, but it's just Dr. Di or Di. My clients, consumers call me Dr. Di.
Groovy. So tell our listening audience a little bit about yourself so that they kind of know who you are.
Well, yeah, I'm a clinical psychologist. It's something that I've been doing or wanted to do my whole life, but I started out actually in corporate America. Came a little later into clinical psychology because I had a strong, I'll call it a calling, to work with individuals diagnosed with severe mental illness. And since becoming a clinical psychologist and a counselor, licensed clinical counselor, I have also had the opportunity to teach graduate students in clinical psychology at Midwestern University. So I'm an advocate with NAMI, I'm a teacher, and I am a provider.
You wear many hats.
Many, yeah. Yeah.
And Dr. Di, you use the term consumer, and I wonder if you could explain that to our listening audience. What do you mean by that?
Well, I think it's very important for people to know that individuals with mental illness do pay for services, and just like a heart patient or a cancer patient, they are consumers in the marketplace. And I think frequently the idea that they are individuals paying for quality services gets dismissed, and they are simply labeled schizophrenic or major depressive or whatever. But they're consumers.
That's a great way to look
at that. Of product.
I really like it. I mean, I've heard about it a few years ago, but for me, the other thing is it's like going to Walmart or someplace else. If I purchase something and I'm not happy with it, yes, my wife will make me take it back, right? Or I'll take it back, right? But a lot of times we don't think about medical services or mental health services, yes, in the same light. And yet these are people that are consuming the services and the interaction. So that's
and Dr. Di, one of the things we've learned on this program is you might not find the right doctor the first time out, right? It might take 2 or 3 different doctors that you visit that you feel comfortable and you can work with.
Bottom line is there's the top of the class and the bottom of the class.
Okay.
I mean, I'll be very honest with you, and it's like anything. You want quality, and you want a personality match with an individual, and you want somebody that's 100% behind you as an individual, particularly when you're dealing with the human mind.
Very good.
That's pretty awesome. Part of the thing it makes me think about is, do we want somebody who's like top of the class academically, or do we want somebody who's like top of the class personality?
You know, that's very interesting question, because I think frequently, you know, I use the analogy of like Juilliard School of Music. Not everybody can play the flute or the violin. And I think empathy is an art. And some people are have perfect pitch, and they can hear really well, and they can hear with a third ear. And other people don't have any sense of pitch at all. And I think you can get A's academically, but not necessarily be a master listener and a master empathizer. And there's a difference. Does that make any sense?
It does,
absolutely.
Because you hear the term all the time that he or she doesn't get me. Yeah. He doesn't get me. And any degree on the wall, that's not going to do it, is it?
No. It's an art. It's an art. It's like I can't tune a piano, but I can listen.
And that's one of the things we hear frequently on this show. Our guests talk about the value of listening to someone else, the value of being a consumer and demanding that you listen. So, Di, tell us a little bit about your professional life. So you got out of here with this passion. Tell us,
yes,
what
well,
you do.
I basically, in the here and now, work with an array of consumers with primarily psychotic disorders. And one of the things that I've discovered about these individuals is they've been in the system, some of them for 15 and 20 years, and never had any real treatment in the sense of listening. And it amazes me when I hear trauma histories of severe sexual, physical, emotional abuse. You know, we're talking akin to a kind of an Auschwitz, and nobody's listened. And yes, we do need medication, absolutely, but we also need to hear these stories. And people go through a lifetime of having a horrific story that's never been heard. And hearing that story can be extremely therapeutic when there is a good listener, a trained professional listener.
That's fabulous. I mean, and that's part of what we're hoping to do at the Suicide Prevention Show is to have conversations that are meaningful, where we listen, changing our world one conversation at the time. Now, you say the word psychotic. What does psychotic mean?
You know, that's a very good question, and it depends on the culture. It depends on the audience. I often say, I shouldn't say this, but if John the Baptist were identified today, well, we would have someone with a rag around his loins down by a river screaming 24 hours a day.
Yes.
And I mean, I'm not an expert but on bipolar, but it's entirely possible that that individual could be diagnosed with that. The difference, someone once at the C.G. Jung Institute told me, the difference between a psychotic and a mystic is the mystic knows who to tell.
Oh, very good.
Oh, I got to remember that. But if you know who to tell, but you got nobody listening, what do?
You're in trouble.
Yeah, and as I would say, are many of our people today who are suffering with these disorders, because who can they talk to?
Right. Well, and talking to a pill bottle is not the answer. You know, yes, the medication is an absolute necessity, but these individuals have stories, and the reality is a lot of them don't have a lot of people to listen to. Mm-hmm. Working in long-term care in the state of Illinois, many people are sequestered off into long-term care facilities, aka nursing homes, at the age of 24, 35, 45, with very few housing options. So,
and something else we've learned, Dr.
very
Diane,
few treatment options. Sorry.
Is that even family members don't necessarily want to deal with this person on that level. They want to pigeonhole them into a category, but when it comes to actually listening and giving them the support they need, even family members aren't there for them.
True, but I do want to say something with respect to family members, since I'm obviously a family member, being an advocate and a National Alliance on Mental Illness person. Families become absolutely traumatized by these illnesses, and I think there is a complete deficit in listening. And the family becomes like a pariah. They're the cause. And the family shuts down. And if anybody, and I'm sure there are people out there who have been faced with, I'll put quotes around it, but psychotic relative or relative that's had a severe breakdown or severe depression, it traumatizes the family. And
it traumatizes the family so much that what we've heard in the past from survivors is that one of the feelings that led them towards thinking about and considering suicide was that they didn't want to be a burden to their family.
I know, and here we always describe that as being a selfish act, if you would. And many of the people talked to, Citizen Mike, one of our last guests, alluded to the fact that she was concerned how people would react if indeed she did commit the act of suicide. So it makes them very much aware that not selfish, but very much aware of the empathy.
Do you also then work with the families as well?
Yes. Oh, absolutely. And I think part of the problem with the clinical fields in general, in many cases, is that it's not just based on a 50-minute hour. From my perspective, the therapeutic process is a therapeutic milieu. It involves not only the adult client, and we're going to be getting more and more adult clients because of everything from Iraq on in. It may have a 75, an 80-year-old, a 65-year-old parent, a wife, children, and the job from a clinical perspective involves listening not only to that patient, or I say consumer, but to the family, who also are part of this interconnected treatment milieu.
So it sounds like today it's not just important to talk to an individual, but you're kind of talking to groups of people.
Yes, yes. And my work, what I have found working in the field and doing research in group psychotherapy is I go back to the old 1970s, don't laugh, but they actually had some good ideas back then. They really did. And,
I mean, other than disco, right?
Yeah, other than disco and
very
Linux and things like that,
Yes.
which also was a group process.
Yes.
But truly, I go back to the ideas of Kurt Lewin and even the idea of group as a whole. And what can be profoundly therapeutic for a person is to be a member of a group. And through Midwestern University and the National Alliance on Mental Illness, we're doing some research on group as a whole work. And group as a whole work looks at not just the individual, but the fact that the individual's pathology can be maintained by the group as a whole. So you get a sick institution, you get a sick individual. And
That's interesting. So it's kind of like you're saying it's not just the individual, but it's the people around the individual that sustain their illness to some degree.
it's an old story, but truly, if an individual is treated in a way that they feel alienated or depersonalized or objectified, just as a schizophrenic, just as a depressive, it doesn't take long, and it wouldn't probably take more than a week for any of us to start feeling pretty horrible about ourselves.
Right.
So the institution, through the labeling process, it's generally very unconscious and by well-meaning people, can perpetuate the person's sense of alienation.
And people belong to various groups, school groups, work. I know we've talked to one lady who she kept her mental illness separate from her work and from her school and dealt with it totally on her own. And yet she was in these other groups, but functioning not at 100%, obviously.
Well, and I do think that that's a very good point, and I think what that brings to mind is how the stigmatization of these illnesses is just immense in our culture today. I don't want to say that we're back in the dark ages. We've got some light at the end of the tunnel, but truly, if someone does work at IBM and reveal they're schizophrenic or some community or organization, they do run the risk of being seen differently. That's just the bottom line.
Well, and just quickly to point out the case of the lady astronaut who went and
Yes.
made a cross-country trip. She got labeled as just this crazy woman wearing a diaper. I mean, the media just took it and ran with that.
Yeah, I just would like to also just highlight, and as NAMI's very good about this, and that is that Leonardo da Vinci, Abraham Lincoln, Newton. There's some pretty profoundly intelligent people. Einstein, the list goes on. Let's come out of the closet with this, that are, genius level individuals. The balance between genius and going over the edge, so to speak, is pretty close in some cases.
All right, very good. Now, we have to take a break. I want to remind people they can go to our website, 1360WLBK.com. They can stop on what looks like a stop sign. And what is that actually, Citizen Mike?
Once you click on the stop sign, you'll go to another page where you'll be able to download this show and other shows that we have archived. You'll also be able to send us an email. Tell us what you think about the show, who you would like to hear as a guest on our show, or if you'd like to be a guest on our show, let us know that as well.
Or if they have questions.
Also, questions. Very good. Yes, Chuck. So we'll take a break. We'll come back, and we'll talk some more with Dr. Dye. You're listening to the Suicide Prevention Show here on 1360 WLBK.
Mental illness does not discriminate.
It affects people of every race, age, gender, and social class.
It could be a loved one, a friend, or maybe even you. But you are not alone.
The National Alliance on Mental Illness supports individuals and families touched by mental illness.
Call NAMI Illinois at 1-800-346-4572 or visit our website at il.nami.org. We understand, and we are here to help.
Welcome back to the Suicide Prevention Show here on 1360 WLBK. Before the break, we were talking with Dr. Dye and talking about your methods, Doctor, of how you treat your consumers. We love that expression. And we, as you said, I love how you explain that to us because, again, it's something that I think when people go for medical treatment, whether it be physical or mental, you consider that you don't have any rights. As you're not a consumer. You're just there. They will tell you how it will be, and that is the way it is. And you're here to dispel that myth, are you not?
Well, what I like to point out, particularly for people with severe mental illness, is from the get-go, the diagnosis creates a milieu where they feel tremendously disempowered. And to start to change the language from patient, being very patient and waiting for a doctor, to consumer, one who pays for services, becomes a step in empowering the individual, I think.
And is it a catch-22 when they want to know if they're having troubles and they suspect something's wrong with them? When you diagnose them and then they realize now there is something wrong, is it more of a relief for them, or again, then they're pigeonholed into this category?
Well, different theoretical models would emphasize or overemphasize, de-emphasize diagnosis. I think diagnoses have reasons for being, but people's diagnoses could change over a life cycle.
Okay.
I mean, somebody can start out depressed, end up bipolar. I find many people have like 20 diagnoses, and I don't know where they've collected them.
Earlier she wasn't willing to say that we're in the dark ages, but I'm willing to say that we are in the dark ages, and that's part of what we're trying to do with this show, is to move towards the light that we see at the end of the tunnel.
Renaissance.
Yeah, and bring more good information, because like you're saying, people rely on diagnoses, and they can be inaccurate, and people have to be quiet because they have this illness.
Yeah, and I want to just say that what happens, unfortunately, and with the people that I work with, is they become the diagnosis. And then what gets split off is the fact that the person's a mathematician, a musician, a brother, a sister, a lawyer. I mean, all these other aspects of the person get cut off.
So it's like a self-fulfilling prophecy almost.
Absolutely. And
well, even when someone has cancer and is diagnosed with, leukemia or something, they become about the disease.
Yes.
And the dis-ease then becomes greater because that is all that life is about. It's the focus there. I really appreciate, Di, what you are saying about, that let's stay on the people track.
I just want to say, in response to what you said, the disease, there's a great deal of dis-ease around mental illness. Mm-hmm. And if it's a tumor, it's tangible. It's horrible and it's horrific and it's a tragedy for the family. But with these illnesses, it's much more nebulous, much more difficult to identify. And I think that the truth is 1 out of 4 Americans has a mental illness, and I always like to say it's possible the other 3 are lying. I don't know. I don't know. So it's more common than we care to maybe expound upon.
Now, you mentioned that you use a specialized type of group. Now, are you able to address these issues with a type of group? Or?
Well, yes. And what we have done, without making it overly complicated, is taken a form of group therapy which focuses on the group as a whole versus the individual, and used it to treat individuals with trauma. I think it's important, and I'm going to give a really broad statistic, and I hate numbers, but I'll do it anyway. 30 to 80, because that's the bottom line, 80% of hospitalized/institutionalized adults have trauma histories. Now, it's very difficult for an individual to talk about that trauma history, and many have not been asked about it for 20, 30 years. But with this group as a whole model, what we do is a given individual might share his or her experience about trauma, and we might say, Sally, thank you for sharing the fact that you've had this horrific abuse situation and been sexually abused, etc. But I think you not only speak for yourself, but you speak for the group as a whole. There are others in this group who have also been terribly hurt by various systems. And this focus on the group rather than the individual seems to open people up more to talk, at least our research shows, to talk about trauma.
So it's a place for them to tell their story in a safe environment, and then also understand they're surrounded by people with not necessarily the same but similar experiences.
They, for the first time, maybe have been living under the same roof with someone for 10 years and not realized that the person they've been living under the same roof with, has a trauma history. Yes. So the sharing of this, and I want to just say that I don't know if anybody in here has ever unloaded something that's really been horrific and painful, but when you unload a problem on a friend, you feel better. Mm-hmm. I mean, it's kind of simple.
Sure.
It changes you biologically.
Di, we have found this in the Center for Grieving Children here in Ann Arbor, that one of the really paramount things about their healing is that they are in a group and they're sharing with others. They don't feel so alone. they feel connected, they feel safe to speak out and to share their story in a very safe, loving, supportive environment. And it sounds as though this is what you've created as well, so that depression that bears down so heavily on us in the experience that they had lifts a bit for them. Is that something?
Yes, and this model of group psychotherapy, group as a whole, modeled off of Tavistock, which is a whole different story and a whole different show. But bottom line is, has really been utilized primarily with, let's call, normotics, individuals that are normotic or highly educated individuals. And what we've discovered, and it's been said that this model would only work with those kinds of individuals, what we've discovered through our research that in fact that's doesn't seem to be the case, that individuals who are what we would say severely mentally ill are able to work with metaphor, are able to tell their stories, are able to deal with very charged psychological issues that might otherwise get tucked under the carpet, thrown under the rug, and just simply medicated over.
You know, that makes a lot of sense to me, because you're talking about people that are severely mentally ill, and oftentimes we find them to have above average intelligence.
Absolutely.
In addition to that, they frequently have these experiences that are different from other people.
Yes.
And so in some sense, they're like the nomadic, or whatever you called that person who's highly educated.
Yeah, what is that word again? Normatic. And
Normotic.
To me, that implies normal.
Normotic, yeah. Well, that's like, I like to, it's just a word I made up, I guess, or somebody made up and I heard. But, you know, we always think we label individuals neurotic and psychotic. Well, what about everybody who's supposedly normal? They're normotics.
All right.
I like that.
Yeah, all right. I'm glad I asked that.
I was doing the
everybody's got to
nomad
have
thing
a label,
yeah,
you know?
yeah,
I mean, that's the culture.
Yeah, and so you're finding in these groups that these people that participate in them are able to connect, they tell their story, and they find a place that's safe. Now, are these just people that are diagnosed with serious mental illness, or does this expand to families, or how does that work?
Well, right now we are working the model in long-term care with individuals with severe mental illness. We just got a publication fairly recently on American Counseling Association Journal, which showed a significant decrease in anxiety and trend in decreased depression over a 30-week period. I've been meeting with a group for over 100 weeks. I mean, these people are serious groupies.
But are they? Do they meet away from the group, or do they only meet in the group?
Only in the group, but of course, it's interesting because with groups, it's just like you belong to a family. You belong to the Boy Scouts. You belong to, I don't know, the Rotary. You think about that group during the week. You think about that group between meetings. So the very regularity of these group meetings and the dedication of the individuals, myself included, who consult to the group, carries through the week. So it's, you know, we all have groups, and a lot of these people, though, haven't had a group.
You talk about we having this group. So when you say, where is this group? Who's we?
This group is right now, for confidentiality reasons, at a long-term care facility, and we are sponsoring the research through Midwestern University in conjunction with NAMI and New Beginnings.
So, but when you're saying that, it sounds like this is not something that's common.
No,
anybody
this
can
is
go
not
find.
common. There is not a lot of research.
This is a specialized area.
This is not a lot. There's not a lot of research out there on this particular modality. There's not a lot of research out there on individuals in long-term care and treatment in long-term care outside of medication management. And I really think the community as a whole needs to realize that these individuals are highly treatable, and per what you were talking about, Citizen Mike, above average intelligence, not that we can even measure that, and potentially highly functioning individuals with very important stories, and how therapeutic it is to have your story heard and to have others witness your story, particularly if it's a story of trauma.
Now, do they actually become dependent on the group? Would you actually develop a dependency, if you would?
Group dependency. Well, I would say we're all group animals.
Okay.
And for these individuals, they maybe have never had a group, and being part of a group can be addictive. I mean, I know I've got my groups. I'm with you guys right now. I've got a group. Being part of a group is a profoundly human experience.
I'm so glad she's bringing that up, in part because part of the thing we're finding is people diagnosed with mental illness are unable to join the quote-unquote normal groups because normal people are telling them, get out of my face. And so they go through life in this sense of isolation, and where people have these groups that they kind of take for granted, these folks, for the first time, it sounds like, have an opportunity to be part of a group that understands that here's their story and that gives them an opportunity to grow. And
we're not just talking like, I'm not criticizing basket weaving or art groups. These are profoundly important groups also, but a processing group where I am a consultant to their group process. And guess what that does? That says you have the intelligence as a group to deal with these issues.
Fabulous.
And I can consult to that. But you guys, hey, you know way more about your process than I do, and I'm your consultant.
Now, I hate to bring the group to a close, but we're right near the end of the show here, too. And Dr. Dye, I just want you to reiterate, because we keep hearing as we do the show the importance of listening. And if you could just kind of reiterate that, too, how important it is to listen and listen to somebody's story.
Profoundly important. I'd say right out of the womb, we learn language by listening and being listened to. And as adults, primarily adults and children, etc., the opportunity to have your story heard, to have memories wove together, sort of like knitting your experience into a tangible whole, into a cohesive whole, produces a biological change in people. I mean, you actually have a story, and many of these people have had no story outside of a darn diagnosis. And the DSM is not the only story. There are human beings behind these diagnoses.
Absolutely.
And that's Dr. Dye. I'm afraid we're quickly out of time. I want to remind people to go to our website, 1360WLBK.com. Click on the what looks like a stop sign. It's got suicide on there. They'll have a chance to hear this show, other shows. You can ask questions. You can email us. Tell us who you want to hear on the show, and we appreciate getting any response from you at all. That's going to be the Suicide Prevention Show for this week.